Executive Director of Planned Parenthood Action Fund of New Jersey. At PPAFNJ, we advocate on behalf of the 2 Planned Parenthood affiliates in New Jersey and its tens of thousands of people who seek health care and education at Planned Parenthood's 21 health centers across the state of New Jersey. I want to thank Congressman Pallone for inviting us here today and continuing to raise the alarm on the harm the reconciliation bill will have on the people of New Jersey. I also want to thank Congresswoman Sherrill for joining us today and President of Planned Parenthood Action Fund Planned Parenthood Action Fund, Alexis McGill Johnson. Last month, Congress voted to eliminate Medicaid coverage for millions of people and defund Planned Parenthood, including here in New Jersey. Republicans in Congress targeted Planned Parenthood and are trying to block patients from getting care. Nearly 200 health centers across the country are at risk of closure, and more than 1.1 million patients will lose access to birth control, wellness visits, STI tests, and cancer screenings. Not to mention the more than 90% of the health centers at risk of closure are in states where abortion is still legal. The number of Planned Parenthood health centers in these states could be cut in half, meaning it will be much harder to get abortion in addition to birth control, cancer screenings, and other sexual and reproductive health care. In New Jersey, roughly 1/3 of Planned Parenthood's patients use Medicaid as their form of insurance. We are in a fight for survival, not just for Planned Parenthood health centers, but for everyone's ability to get high-quality, affordable health care, no matter how much money they make or who they are. Together, we can keep sounding the alarm on the harm that defunding Planned Parenthood has already begun to cause. Thank you. And with that, I'd like to welcome Congressman Pallone.
Thank you, Caitlin. I have to be reminded that there's no microphone per se. Thank you, Caitlin. And let me thank all of the Planned Parenthood affiliates that are involved here. We're at the Perth Amboy Health Center, which is in my district. But I do want to emphasize that we're talking about today doesn't just relate to my congressional district, but to the state of New Jersey and to the nation as a whole. Right now, we estimate that something like 1.1 million people with Medicaid, and I want to stress Medicaid, come to Planned Parenthood every year for care. Now, I'm going to kind of talk about this in terms of reproductive care, but I also want to talk about it in terms of health care in general, because you have to understand that with these Medicaid cuts, which is what we're talking about, people that come here to the health center, many people are on Medicaid, right? But they had never been able to use Medicaid for abortions. I want to stress that. But what this big, beautiful bill does now is to say that you can't use Medicaid for your basic health care, for anything, right? So it used to be, and it still is today, because it hasn't gone into effect as an injunction against these provisions in the big, beautiful bill, that many people came here, not just women, but even men. I asked about men, and I was told about 10 to 15% of the people that come are actually men, right? They come here for basic health care. And that's true around the country. People come to Planned Parenthood clinics for basic health care. They'll come here to get, a physical examination. They'll come here for things related that are part of reproductive care, like birth control, cancer screenings, screenings for venereal disease, for example. But it's basically, for many women and some men, the place where they go to just get basic health care. And so what you're doing is, if you're saying they can't use Medicaid for those purposes at a Planned Parenthood clinic, which is what this big, beautiful bill does, you are denying them access to basic health care. And I want to stress that. But it's also a backdoor way, because Caitlin mentioned it, I believe, it's also a backdoor way of preventing people from getting an abortion, which is their right, under New Jersey law, that they can come and have an abortion if they want to. It can't be paid for out of Medicaid. But if you defund Planned Parenthood, because so many people now won't be able to come here for Medicaid, then you're going to have a direct impact on places like this. They'll either have to close or they'll have to cut back on the number of people that they can see. And so it is a backdoor way, if you will, of preventing people from their right to an abortion as well. And I do have to stress that, because that's what President Trump and the Republicans at Congress are all about. They don't care whether you have access to health care. They do not want you to have an abortion, even though it's your right, under the law in our state and so many other states as well. So this hostility, if you will, to Planned Parenthood is really is really a severe thing in terms of so many people who use Medicaid as their basic health insurance, and we have so many in New Jersey and around the country. Now, before I introduce Mikie Sherill, I just want to say one thing. I am determined to fight this. We know it was passed by Congress. There's now an injunction. We support the injunction to prevent this from coming into effect, that Medicaid can't be used at Planned Parenthood clinics. And we're going to continue this battle. And so that's why I'm so glad that the president, the national president of Planned Parenthood, is here today with us. I'm really honored that she's here. Mikie will introduce her. But let me just say one thing, if I can. I could say many things about Mikie Sherill, but I want to say one thing today, if I can. I want to emphasize how during her term in Congress, that she was always standing up for women's rights, right? She's always standing up for women's rights. She's always standing up for reproductive rights. She's been on the front line. I chair the committee called the Energy and Commerce Committee that deals with all these healthcare issues that I'm mentioning today. But she's always been there with me, fighting against these cuts to Planned Parenthood, in this case an outright prohibition of Medicaid. And the Republicans have been doing this a long time. This is only the latest manifestation. And Mikie Sherill has always been there fighting for women's rights and reproductive rights every day. So with that, I'll introduce Congressman Mikie Sherill.
Thank you. Wow. Well, thanks so much. It's wonderful to be here with Congressman Pallone, who has been such a champion for us, the former chairman of the Energy and Commerce Committee. His leadership and his tireless advocacy for the patients who walk through these very doors has been tremendous, and I hope in the very near future I will be calling you chairman of the Energy and Commerce Committee again. Thank you also to Dr. Talman and Assemblywoman Lopez, who could not be here with us, but who is such a champion herself. Partners I'm really proud to stand with as we fight to protect reproductive health care in our state. And of course, thank you to Alexis McGill Johnson. Your leadership at Planned Parenthood Action Fund is absolutely critical right now. So we're here because Donald Trump and House Republicans are attacking Planned Parenthood and stripping away access to basic health care from millions of American families. And for years, Republicans have been chipping away at women's reproductive rights with one clear goal: to ban abortion and restrict access to essential care. And this bill is just another dangerous step toward that goal. This legislation blocks Medicaid patients from getting care at Planned Parenthood. It cuts off access to birth control, cancer screenings, STI testing, and abortion. It punishes people for where they get their care, putting politics between patients and their doctors. And here in New Jersey, Planned Parenthood is a trusted provider. In 2024 alone, health centers across our state saw more than 123,000 patients, providing 140,000 cycles of birth control, 170,000 STI and HIV tests, and 13,000 cancer screenings. 1 in 3 of those patients relied on Medicaid. And this care is essential. It's how people plan their futures. It's how people protect their health. And this bill puts it all at risk. Sadly, 3 of my Republican colleagues from New Jersey, Tom Kean Jr., Chris Smith, and Jeff Van Drew, voted for it. They turned their backs on the New Jerseyans they should be representing. We've already seen what happens in states that try this. In Texas, patients lost access. Unintended pregnancies went up, and cervical cancer rates rose. Indiana's clinic closures contributed to an HIV outbreak. Iowa lost more than 80% of its family planning services. These are the real consequences of letting ideology drive healthcare policy. Even right here in New Jersey, cuts to Planned Parenthood have led to serious consequences. In 2010, Governor Chris Christie defunded Planned Parenthood, and STIs went up by nearly 27% over the next 5 years. That's what we are talking about. I fought against this bill in Congress because I know what's at stake. I know how many families rely on this care. And I'll keep fighting to restore these services and protect reproductive health care here in New Jersey. I'm proud to stand with Planned Parenthood, the health care providers here today, and every patient who walks through these doors. No one should lose access to care because of their income, their zip code, or the politics of the moment. Thank you again for having me, and it is now my honor to introduce someone who's been leading this fight every step of the way, Alexis McGill Johnson. Thank you.
Thank you. Thank you, Sherrill.
Good afternoon, everyone, and thank you for joining us here today. I stand here not only as the president of Planned Parenthood, Federation of America, and the Planned Parenthood Action Fund, but also a proud daughter of New Jersey, actually hailing from your district, Rep. Sherrill. Look, last month, congressional Republicans eagerly rubber-stamped President Trump's law defunding Planned Parenthood health centers, which could block more than 1.1 million patients who use Medicaid from getting their care at their local Planned Parenthood. Unlike those who traded away health care for millions, some lawmakers, including Rep. Frank Pallone and Rep. Mikie Sherill here with us today, fought hard. They fought hard and tirelessly against this measure until the bitter end. We are so grateful for the support, and we also know that this fight is not over. The consequences are devastating for Planned Parenthood Health Center patients and everyone who will need care one day. That's why Planned Parenthood Federation of America, on behalf of all of its member organizations, immediately took the Trump administration to court. Okay? While many are capitulating to this administration, Planned Parenthood Federation of America stood up to fight this clear attempt to attack and punish Planned Parenthood for proudly providing and fighting to protect abortion care. Last week, PPFA won a critical victory against the Trump administration when the District Court of Massachusetts blocked the defund provision from being enforced while this court battle continues. That means that patients can use their Medicaid health insurance to get care at Planned Parenthood health centers right now. And that's what it's all about, making sure patients everywhere can get the high-quality care they rely on no matter what. Make no mistake, there is still a long road ahead of us, but this is a fight that we cannot back down from. Defunding Planned Parenthood will do incalculable harm to Planned Parenthood health center patients and the public health infrastructure. If allowed to go into effect as intended, as many as 200 Planned Parenthood health centers in 24 states could be at risk of closure. A majority, 60% of those health centers at risk of closure, are located in rural areas or places where there aren't already not enough primary health care providers. That means in places where there are few, if any, other options of care, patients could lose access to everything: STI testing, birth control, cancer screenings, abortion care. President Trump and the congressional Republicans who voted for this own this crisis. Because of them, cancer screenings, cancers will go undetected. STIs will go untreated. Patients won't be able to get the care they need to plan their families and their futures. Because of the unreliability of our healthcare system, already strained under the weight of COVID, the abortion access crisis caused by Dobbs, and just the general challenges of delivering healthcare in communities in these times, this added strain of defund is going to force some Planned Parenthood health centers to make shifts, some to reduce services, some to close, and other providers are simply not going to be able to make up the difference. This is not a big, beautiful law. This is a big betrayal of the American people. Patients are going to have to travel further to get their care. They will have to wait longer as demand increases. This is harm that is on their hands. The Planned Parenthood Action Fund is going to continue to fight, and we're going to continue to call out all of the lawmakers who have voted for this bill, and we will ensure that they are eating their votes every single day on the behalf of our patients. And now I'd like to introduce Dr. Elizabeth Talmont, who is a provider here at Planned Parenthood of Northern, Central, and Southern New Jersey, to give some remarks. Thank you.
Thank you and good afternoon, everyone. My name is Elizabeth Talmont, and I am proud to serve as the Chief Projects Officer and be a clinician here at Planned Parenthood of Northern, Central, and Southern New Jersey. I've worked at Planned Parenthood in some capacity for well over 2 decades, and I can say with certainty and experience that this is the toughest time and the toughest challenges we have ever faced. Every day when I care for patients who turn to Planned Parenthood for high-quality, affordable reproductive health care services, Let's be clear, this care is essential. It's birth control, it's cancer screenings, it's STI screenings and treatment, wellness visits, and it helps people take control over their lives and their futures. So until this big, beautiful bill was enacted, my patients knew that they could rely on Medicaid insurance to cover the costs for these much-needed care. But today, that coverage is in serious jeopardy. If allowed to go into effect, Planned Parenthood will no longer be able to accept Medicaid. This forces my patients to either find care elsewhere, where services may be limited or delayed, or struggle to afford the care that they need. For many, this creates insurmountable barriers to access and worry. I want to make one thing crystal clear. Planned Parenthood of Northern, Central, and Southern New Jersey, our doors are open. We will see you. We stand in defiance of these attacks on our patients' rights and freedoms. My colleagues and I continue to provide care to everyone who walks through our health center doors. And we are working with our patients to ensure that it remain affordable and accessible as possible. But we cannot ignore the reality of this bill that could have long-term devastating consequences. Already, Planned Parenthoods have had to close, in other states, have had to close health centers, reduce services, and lay off staff. Here in New Jersey, we are constantly assessing the needs of our community. We are constantly making sure that we're making strategic assessments and decisions so that we can continue to be here and be strong. But truthfully, the impact on my patients is what worries me most. Where will they go for their reproductive health care? How can they afford groceries and birth control at the same time? How will they make these decisions? And how much worry and energy do they have to expend to prioritize their health? And this administration continues to strip them of their rights. What will happen? This is what worries me most. So I am so thankful to Representatives Pallone and Sherrill for continuing to sound the alarm on this issue. We are proud to fight alongside you, our patients, my fellow providers, for our state and our country. Thank you. And thank you, Alexis.
Do we take questions? Any of the media have some questions you want to ask?
The injunction for, first of all, we sued the Trump administration because we believe that banning access to Planned Parenthood by taking away Medicaid funds is really a violation of our First Amendment rights. Essentially, this is an ideological attack. This was an attempt to enact a backdoor abortion ban. And we can prove that simply because when we saw this legislation come forward, right, this is really designed to attack Planned Parenthood, right? The language about going after big abortion, going after big abortion providers was designed, and I think my incredible thought partners here in Congress can speak about those conversations. But they were really designed to trap Planned Parenthood and defund a political opponent simply because we provide abortion where it is legal. We believe that violates our First Amendment rights, and that is what the judge in Massachusetts also believed, and that is why we believe we won the preliminary injunction. But I'd invite my congressional representatives here to speak to that too.
I think she answered.
Oh, okay.
You answered the question.
Okay, good.
Any other questions?
Congresswoman, if the attacks to succeed, or if the attacks on Planned Parenthood succeed, are there ways potentially to supplement Planned Parenthood in the state through state dollars if you're elected governor? Is that something that you would like to do?
Yeah, so I think there are a lot of ways that the state can act in this moment, but again and again and again with the big beautiful bill, we just see attacks on every level of affordability, and it's coming fast and furious. It's breathtaking to see the economic attacks on the state of New Jersey, whether it's the tariff program that's driving up costs for everything, the big beautiful bill which drives up housing, health care, and utility costs, and then these direct attacks, because remember, the Medicaid cuts don't just impact Planned Parenthood, they impact 1 in 3 children who receive health care through them, seniors, possibly hospital closures because of losing some of the Medicaid. So we are seeing attacks across the board, and that's why it's going to be so important for an expansive view of state power to step into this breach, while at the same time to continue to fight back against this. That's why I think the court battles are so incredibly important as we're working here in New Jersey to claw back some of the federal dollars.
I mean, keep in mind that you're talking for Medicaid alone over $3 billion annually in cuts, and that doesn't count SNAP, which is funded through the counties. How is it possible for all levels of government in New Jersey to make up for all these Medicaid, health care cuts, nutrition cuts? I mean, it's virtually impossible. But go ahead.
Yeah, we know that cuts to Medicaid are going to detrimentally affect Planned Parenthood patients across the country and here in New Jersey. And I don't think we have to imagine what can happen. You know, as the Congresswoman highlighted, we saw what happened when Planned Parenthood is defunded in New Jersey under Governor Christie for 8 years. We saw STI rates go up 30% around the state, and it was higher in some counties. We also saw cancers go undetected, and so people's cancers were getting caught later and later. It was detrimental to the public health of this state, and so if we have the double whammy essentially of a defunding of family planning funds in the state as well as Medicaid defund federally, there will be just really adverse health outcomes for the people of New Jersey.
My last question, so this was Dr. Does this facility do all of the aforementioned healthcare procedures, and would it be at risk of closing if the bill stuff was approved?
Yeah, so we're standing in front of a health center that provides us cancer screenings, birth control, a variety of different birth control methods, as well as STI testing and abortion care. So if those cuts go into effect, we are constantly surveying and assessing where the greatest need is and how we can best address it. We certainly value the support of our state partners, but there's no getting around it. You can't make up all of that money just from the state. So we value those partnerships at the state level, but it's all on the table.
All right, are we done? All right, thank you so much. Thank you all.